Now, it is part of a recurring message I want to get across here is how well things are linked up now across borders. This is the European COVID registry. Now, this is aimed at all rheumatic diseases, so not just vasculitis. As I mentioned, there's under 10 patients in Ireland. This group has got data now on over 3,000 patients with rheumatic diseases across Europe. So they've kind of pulled all this together into a large database, and they're starting to ask questions about that. But you can see here that these are the diagnoses that they've included in this registry, and it's dominated by things like rheumatoid arthritis. Down the bottom there, you can see ANCA-associated vasculitis and giant cell arteritis. So these constitute, reinforcing the fact that these are rare diseases, a very tiny amount of this, this overall database across Europe. So we have tried to look in more detail across UK and Ireland at all of the cases with COVID. And again, Emma's going to say a little bit more about this, so I'm not going to dwell on it. But again, just to illustrate the cooperation across the border, sharing the case. And this is about to be published, the experience. And the bottom line really is that the symptoms that people get with COVID, if they have vasculitis and whether they're on immunosuppressant drugs or not, is fairly similar to the overall population with shortness of breath, fever, and cough. And the problems that people get are very similar as well, with problems with breathing and in the kidneys. So again, I'm going to let Emma talk a little bit more detail about this, but the kind of bottom line really is that we wondered when we were looking at this whether the immunosuppressant medications actually would protect against the bad aspect of COVID. Some of you may have heard of the cytokine storm, which is seems to be causing a lot of the problems in people with COVID. And of course, immunosuppressant drugs suppress the immune system, so and it's the overactive immune system that seems to be causing trouble. So maybe the medications are somewhat protective. It looks like in this and in the European one that it's probably balancing out, in the sense that the outcome or severity of COVID is probably similar, or maybe it's very, very slightly worse than the general population. So the fears that we often have in infection with immunosuppressant medications aren't really being borne out. So it looks fairly similar to the general population, which I think is somewhat reassuring. Because some of you may remember that at the start of the COVID epidemic, we were like, you must be at home and shielding, and you mustn't meet anybody. And I know that Mike kind of gave some reassurance again about that last night. Okay, so what these things, efforts to work out the effect of these are always problematic because there are so few cases of vasculitis. It is a rare disease. So as you can see, we have managed to identify 65 people across the 70 million or so across Ireland and the UK. And they've identified 53 across Europe in the EULAR European registry. So what we've been trying to do over the last couple of years, and now it's happening with another European project called FairVasc, is that we want to get past data protection, not get past, but work with data protection laws across Europe. And just to reiterate that the interpretation of the data protection laws in Ireland are by far the most stringent and create a major barrier to health research in Ireland, frankly. So it's been a lot of effort to try and work with these regulations and work with other registries across Europe, in the UK, in France, in Germany, Czech Republic, Poland, and Sweden, to set up a mechanism whereby we can obtain information on patients from all of those countries and more in the future, I hope, at the same time using a piece of software that will look at the information across all of the registries. So again, another example of how we are linking in with the wider European community to learn more about this rare condition. Okay, so the third thing that I want to allude to is our AVERT project. Now, we've talked about this pretty much every year for the last 3 or 4 years, and it's a big data project, and the essence of it is that we are searching for the trigger for vasculitis, and specifically for the trigger for vasculitis relapse. There's something perhaps in the environment, be it pollution or a bug or some kind of weather, UV exposure perhaps looks like a likely culprit, or more likely a combination of all these things in some subtle way that lead to the immune system actually being turned on again and causing vasculitis again. So this project stuttered for a while, mainly because the app that a lot of you are involved in now was quite problematic and not really doing what we thought it would do. So that, again, I'm pleased to say, has changed in the last 6 to 9 months, and we like to call it the Vicky effect. Vicky Carr is on the call, and Vicky is going to, again, say a few words about this and the app and how it's helping helping us to learn about vasculitis. And Vicky, you might just say hello.
Hi, everybody.
Good. So Vicky will come on after me, and we'll give a bit of an update. So as I say, we're trying to work out what this trigger or triggers are. And the question I have for you now, because I would like you to help us with this if possible, is that we have a lot of the information now. We're able to work out how to link people to their environmental exposure as they move through time, which is really, we thought would be the hard bit. And we're trying to analyze this at the moment using artificial intelligence techniques and advanced statistical techniques. But we've come up across a real problem, and we're trying to work out, because to do this, we need to, when we do all our statistics and artificial intelligence, we need to work out when a relapse starts. We have to assign a date to it. And we use the registry as our source of information, and we have a date in the registry, but we know, and I know when I see patients with vasculitis, and Michelle knows, that it's been generally bubbling up for a while. By the time we get to see you in the clinic, and also there may be a variable delay in how long it gets to be seen in the clinic. So we need to find some way of hearing from you and learning from you as to if you have had a relapse before, how did it start suddenly? The day before you saw a doctor, or was it bubbling up for weeks or months even? So one of our PhD students, Daniel Dempsey, is trying to get together a group of people who can really start looking at that question carefully. But I'd like you to possibly, if you could drop it into the chat here, and if you have any ideas about this yourself, and if you have a clear view yourself, if you had a flare or relapse, you could perhaps drop it into the chat, and we can start learning about that to help us build the statistical models. So to again, extend this view of working out what these environmental triggers are to the European stage, because what we found also with the AVERT project is that, again, we're what we call underpowered for our statistics. We just don't have enough events, which is good, obviously, for for the community, but it means that it creates a challenge for us. So again, we are looking to Europe, and this is the Helical project, which has been going properly now for about a year. And what this is, it's got 15 young researchers. So this is designed to train early stage researchers in scientific methods to study these rare diseases. So this is the 15 Helical researchers. They're scattered across various countries around Europe. The 3 people from Iran are part of it as well. Some of them are a little bit shy about sharing their head and shoulders shot. This is from the website. But a fantastic group of young people who are now really digging into this question about particularly the top 6 there in the upper half of that picture. They are all examining a little piece of this puzzle as to what the environmental triggers are of vasculitis. And as I mentioned, Juliana, the project officer, is actually on the line here as well. And she's overseeing this project and making sure that we're sticking to the rules as defined by the EU. I don't know if you want to say hi, Juliana, or putting you on the spot or anything. But
hi, thank you very much, Mark. Thank you for this invitation. It's really great. It's my first time joining the group, and I am very happy. And as you know, I'm also a patient, so I'm interested as well. And I will follow the discussion. Thank you so much to all of you.
Great to have you online, Juliana. Great to have you online. So Helical is very exciting. Lots of really good ideas. All these young researchers are kind of getting together, and they're sharing methods and sharing their research results. So at the year end, it's a 4-year project, so it'll take a little while to really finish up. So I'd like to finish just with another final piece of good news, which we again talk about every year when we do these talks. And that is the news that steroids aren't going to be needed anymore. So that's Satan's Tic Tacs, as they're called, I guess. There's a really good chance now that steroids will not be needed anymore. So this is the ADVOCATE trial. We have mentioned again before that there's a couple of new medications on the block, and the leading one is something called Vaccupan. And this was the medication that was tested in this large global trial comparing a Vaccupan head-to-head against steroids as a means of treating acute vasculitis after a diagnosis. So this is the headline release was a couple of months ago now, and they had a positive top-line data from the ADVOCATE trial, and this is the table that summarizes that. This is not published yet, actually, in a journal, but so it hasn't been peer-reviewed, but the results are so clear-cut that it's undoubtedly going to be a game changer for this disease. Just a couple of the headline figures there is that the remission at 52 weeks, this is total remission off therapy remission. About 66% of patients, or 2/3 of patients in the Vaccupan arm of this trial. So this is a randomized trial. People didn't know what medication they were receiving in the trial until the code was broken at the end. So it's about 2/3, and just over a half of the patients on the standard steroid arm, 55%, were in full remission. So Vaccupan, not only is it equivalent or as good as steroids, it's actually better. And it has none of the steroid side effects. And there are very So these are these GTI scores, glucocorticoid toxicity scores. They're much, much lower, of course, because they didn't receive any steroid. And kidney function at a year was also better. Not only was it as good as, it was actually better than the steroids. So, and there was a lot of quality of life measures as well, and they just, were so much better than the steroids. And we hear repeatedly as doctors about how much steroids are hated in terms of weight gain and mood swings and skin changes. So this is a real, I think, a real positive thing for the vasculitis community. And there will, of course, be an issue of cost with this. This is definitely going to be more expensive than steroids. So there will be a fight involved. So it's important that patients make their voices heard when this fight starts, because we would take the view that because there are no steroid side effects, that when you add all the costs together, it actually works out not more expensive. So that'll be the real challenge for the company and also for the community to make that case when it comes to paying for medications. But expect to see a Vaccupan appear within the next 5 years, definitely as a key means of treating vasculitis. So I'd like to finish there and hand it over back to Valerie again and Trish.
Okay.
I'm very happy to take any questions.
Yes, thanks so much, Mark. That was brilliant, giving us a great overall of the insights to vasculitis world. There is some questions there. Some people, maybe, will I let you read them, or will I? It's people with Ricketts and Sjogren's disease, urinary.
I can start having a look through them. We might not get through them all. There's quite a lot. If we don't get through them, I'll try and answer them offline and send you some answers, Trish. Yeah.
Okay. So a couple of them are about stress seems to be a trigger. There's one there. An infection.
So from Mike Harrington, for those with recent diagnosis and not remission, typically how do you know if you have a flare? Well, I think generally I'd say that if you're very soon after the date of diagnosis, we do not really use the term flare there. We generally only use the term flare or flare up when you have gone into remission and then it comes back again later on. So in those first 3 to 6 months, if you, it's a period when the immune system is gradually being suppressed and the disease is gradually getting better. So there will be definitely times within that period where, if you feel a little bit worse or feel a little bit better, but my general advice is that assuming the diagnosis is correct and getting the right medications, that it does take a little while to settle down, and it usually does. If it doesn't, then I think to think carefully about the diagnosis, whether it's correct or not, and whether the medications are right. And this is, I think, is where the Vasculitis Ireland network comes in, is to, when tricky problems like that arise, we can discuss the case as doctors between ourselves.
Okay,
so flares happen in very cold weather. This is from Marion. Or very hot weather, when I'm overtired or stressed, when I get ill with something else after an operation, spicy food. So that's definitely, I mean, we often do hear that, certainly with stress, and there's a lot of basic science work that looks at that and the effect of stress on the immune system and on your own body steroids. they get quite affected if you're stressed. So we do often hear that the flares are associated with the episodes of stress. In terms of weather, it's a tricky one, especially with hot, cold, or weather. So that's what we're trying to address with the AVERT trial or the AVERT study is a very difficult question to answer. I would kind of refer to the Cloudy with a Chance of Pain study, which was an inspiration for us. Again, a smartphone study where they asked whether the weather impacted symptoms of joint pain. And the bottom line is that it does. And it's likely to be related not to hot weather or cold weather, but to humidity. And that's what they found. So we haven't got the answer yet from our study yet, but hopefully we will. So again, Nikki says flare after stressful situations, house move, and weather changes as well, getting run down.
Another one about
physical, emotional stresses. We're busy. When I have another infection, like a chest infection. So it's a really interesting question about the impact of other infections, and we'd often do hear this, that I had a flu a little while ago, and it seems to have triggered my vasculitis again. And of course, this question applies massively to COVID, and there is some suggestion that COVID may activate vasculitis as well, as often some viral infections do. So that's definitely a very interesting question. Difficult to answer though, definitively. So Marion asked about the Orteleza drug for Behçet's. Now I have to be honest that I don't treat people with Behçet's generally. I tend to end up with the rheumatology guys. So I've not used Orteleza before. So that might be one for Eamon Malloy, although he spoke yesterday, didn't he, Trish?
Yes, yeah. So we can take that and come back to you maybe, Marion.
So Anrita says, we didn't know my husband was having a flare, but a new area of damage showed up in the MRI. GPA was suspected CNS vasculitis. So he had a very kind of difficult condition. And often the question arises, Rita, and I don't know this, obviously the details of the case, all right, but the question arises whether, with stuff in the brain or elsewhere, whether this is due to vasculitis or just something else, such as a stroke, normal stroke. So it's again another scenario, really difficult scenario where discussion among various specialties, including neurologists, can often lead to the right answer.
I think that's it, Mark, is it?
Yeah, I think that's the lot.
Yeah.
So Pam, do you want to just, you have a camera there, just to say hello, and I would like you to put people to put a name to the face. I think generally, Trish, people can have their cameras on, because
yeah, it's just the sound is getting a bit tricky there. So
the camera doesn't affect the sound, though, Trish, as long as people remain muted.
Okay. So we're going to take Pam is going to introduce herself there. Pamela O'Neill.
Yeah, hi everybody. Delighted to be part of the team and really looking forward to getting my hands or getting stuck in. Really enjoying it so far. So hopefully, I can meet with all of you and get to know you a bit better.
Lovely.
Great. Thanks, Pam. So you've got a face on the name now. Okay, so I think we maybe just give Michelle just a minute or two just to say hello as well. Trish, is that okay?
Yeah, or we'll let Vicky in then after, is that the way?
Yeah,
Vicky is going to come next, but if Michelle is on there now, whichever.
Just want to say hello, really, I think. Yeah.
Perfect. So I'm Michelle Shaughnessy. Thank you, Mark, for the kind introduction. I had been studying and treating patients with actually vasculitis amongst other forms of glomerular disease in America at Stanford and California for 6 years prior to moving home late last year. And I'm a nephrologist now at CUH alongside Mark Clarkson, who you heard from yesterday. So while in America, I was working at a glomerular disease center. So glomerular diseases, vasculitis is one of those. They're usually immune attacks on the little filters or the glomeruli in the kidney, where you leak blood and protein in your urine. And if that's not treated, you can develop kidney failure over time. But vasculitis is one of many of those. So in the America, I had been working with a kind of a national group of people, a good network of people studying patients with these conditions, including vasculitis. And then when I returned home, I was really looking to continue and expand that work. And I was very lucky to link up with Mark Little and Mike Clarkson, who works with me at CUH, and to join them in the national vasculitis efforts. So thus far, I'm treating obviously patients with vasculitis and also helping to study potentially patients of which thankfully there are very few so far, but patients with vasculitis who might develop coronavirus over the next few months or years. And then I'm also going to learn from you also, in addition to meeting you. I'm hoping to expand some of the wonderful work that Mark highlighted at a national and a European level in vasculitis to other rare forms of kidney disease where there's an immune attack on the kidney. So in addition to helping and supporting all of you and treating you and attending these events and speaking at these events if you would like me to, I'm hoping to learn from the wonderful efforts that Mark and Julie Power and all of you here are doing to advocate for research and advocate for support and advocate for education for patients with vasculitis to patients with other potentially even rarer types of kidney disease for which there isn't the same national or even European effort ongoing. So again, I just started at CUH in January. I'm recently returned, and I'm trying to kind of integrate myself with this community. So I'm very grateful for the opportunity just to meet you all. Again, like Mark said, to put a face with the name.
Okay, well, that's great, Michelle. That sounds really exciting. We've got another interested leading researcher and practitioner in vasculitis for Ireland, and I know Mark will make good use of your resources. So
absolutely, he's been a wonderful support. So thank you, Mark.
It's very reassuring for patients to know that. Can I just go back to ask Pam? It didn't quite. Just so you're the national coordinator in Tallaght Hospital for. Can we just. Because you're not on the programme, Pam, so I just want people to be clear.
Yeah, I'm the Vine coordinator in Tallaght Hospital, and I looked after the application for the European Reference Network with Mark. So I more or less look after the admin side of things.
Okay, that's great. So that's great for patients to know that, you know, that link with Europe is all developing and being developed, and you're the lead, you're the face behind it. So that's lovely. Thank you, Pam.
Thank you.
Now we're just going to hope everybody's doing okay. We're going to introduce Vicky Carr. She's the new research nurse that's working with Professor Mark Little on the AVERT project, and she is trying to. There's been an app developed for the last few years, and she's just trying to bring that app, connecting it with ourselves, with the patients, and trying to develop that to a greater degree. So I'll let Vicky explain what her work remit is now.
Hi Trish, thanks a million for inviting me to give everybody an update on the AVERT study. I have a small presentation that I was going to do through share screen, and it'll give everyone an overview of the study and the app and how it works. And then at the end, I will go through our newsletter, which gives a overview of on a monthly basis how many people are using the app. So can everybody see that? I'll do this presentation first.
Yes, we can, Vicky, yeah.
Okay, So the study itself was launched in December 2007, and as mentioned before, Professor Mark Little is the primary investigator. It's aimed to be done over a 5-year period, and we are hoping to recruit 250 vasculitis patients to use an app called the Patient Empower app. So it investigates, as Mark mentioned earlier, is there environmental encounters which can trigger a flare of someone's vasculitis, whether it be through infection, weather conditions, or pollution in the air. So to be included in this study, the AVERT study, you have to be diagnosed with ankylosing. You must be registered on the database which Mark mentioned, the rare kidney disease database, over 18 years of age, and then the consent process for the app is done through the app, which can be very handy to consent to the study. Once you download the app, you consent to the study through the app. This is the hospitals involved to date. So we have Tallaght Hospital, we have Beaumont University, St. James's, St. Vincent's University Hospital, Mater University Hospital, Limerick University Hospital, Galway University Hospital, Cork, which has come on board recently, and we're starting to recruit from Cork, and Waterford University Hospital. The app itself is called the Patient Empower app. It was developed by an Irish company for research purposes. The app can be downloaded depending on which phone you're working off, whether an Android or an iPhone, through the appropriate App Store or Play Store. I'm going to show a picture of the home screen of the app, so when if you do go looking for the app, what the icon looks like, because there's also a COVID version developed of this app. So we're just interested in the original app that was developed for the study. It's important when this app is downloaded because it will be used by other consultants as well, but for our purposes, there's a code which links the information to us, and the code is the name of the study, which is called AVERT. And you're asked for this on download. And then you go through the consent process through the app, as I mentioned earlier. So this is what the app looks like when you search for it in your relevant store to download an app. And the important thing I always tell people to focus on is the M. The COVID version is slightly different, but the one that we want, it's just a plain simple M for the Patient Empower. The main purpose of the app through using it for the study is, one thing we do capture is someone's location. I'll go into that in a little bit more detail. There is a survey known as an EQ5D, or on the app it is called a monthly vasculitis research survey, and we would encourage all users to do this monthly. I'll go into a little bit more detail about that. There is you can put in on the app also journal entries, which allows you to capture symptoms you may feel, or if you developed a rash, and I'll explain that a little bit in more detail. And you can also capture your step count, your activity. You can link the app into, some people do it through Google Fit, some people do it through, I know the iPhone version tends to work a little bit better for this aspect of it, but you can link your activity to it. So if somebody did download the app, there's kind of 4 main pages on it, and I would assist people when they initially download, or who have downloaded a few years ago and they're not maybe using the app well, and I try to talk them through it on the phone, which seems to be working quite well. So I always get people to focus in on that red plus symbol, because it can be a bit busy and it can throw people off. So I always say, just focus in on the red plus symbol, and the bottom here shows the 4 main pages available on the app. So when it is blue, it's highlighted. So the house is your home page, which will give an indication of just a summary of your use on the app. Isn't hugely vitally important. Then the most important part of it is to the right here, you can see the surveys, and that is your vasculitis research survey to be done on a monthly basis. My Data allows you to capture information in relation to blood pressure readings, oxygen saturations, temperatures, and you can see some blood results in there as well. And then More is another function of it that allows you, what I have noticed, some people had downloaded the app but didn't put in the code AVERT, so their information wasn't linking to me, which is really, really important on download that AVERT is put in. So that's what the home page looks like, and this is the focal point that I always tell everyone to focus in on, is this plus symbol, and not to be focused too much on what's actually on the page. And I'm going to go through the EQ5D in a little bit more detail. So as I mentioned before, it is very important that we capture your location. And this is done through a unique study number. So it's never your personal details used. For data protection, once you download the app, you are given a unique study number. It gives a focal point for the study to be able to capture the different locations you're in. For them to work in the background in relation to if there was a flare-up of the vasculitis, to look at different locations which will be captured through the app. And it gives a focal point to look in for at the weather at the time and the air quality. And as Mark had mentioned, at the moment where they're trying to capture an event, when an event is actually occurring. So at least if we're capturing your location, through the app, we have gathered that information. Then the Vasculitis Research Survey. This is also known as an EQ5D. So this allows us to capture how somebody is feeling on the day they complete the survey. When I'm talking to people over the phone, I would recommend that they do this on a monthly basis, and we can set a reminder through the app to trigger a reminder to do the EQ5D. It's a 6 questions are asked. It captures how somebody feels on the day they complete it. It's always going to be the same format, in that the more you use it, the more familiar you get with it. It takes literally, I'd say, 30 seconds to complete, because once you become familiar with it, you know where the answers are, and it's a tick box situation. If somebody is feeling unwell, I do ask them to complete it a little bit more frequently, so that can be captured through the result. So this is an example. The first question asked is about mobility. Now, unfortunately, these slides went in the wrong way around. So this is what it would look like before filled in. So mobility, you're asked, I have no problems in walking, I have slight problems in walking, I have moderate problems in walking, I have severe, or I am unable. And generally, when you just tick whichever one is relevant to you, you can see here the icon will become red, and you just press next, and you're brought on to the next box, which is anxiety. And oh, sorry, I must have skipped one there. So the next one is self-care. Again, it's the same format. I have no problems, I have a slight problem, I have a moderate, a severe, unable. You tick which anyone is relevant to you, press next, then you'll be brought on to your usual activities. Same structure again. I have no problems, I have a slight problem, moderate, severe, unable. Tick whichever one is relevant, and next again, and then you're brought on to the same structure for your mood and for pain. And then the final of the 6 questions is where you are asked to fill out a visual analog scale based on how you feel today, with 100% being the best you feel on a daily basis. And literally, you just drag the finger across this, where this red dot is, and what will appear up here is a number, which you can see on this picture, KISS come up at 98, and then wherever you feel is relevant for you, you stop, and then you just press submit. Now, I know the iPhone, it works a little bit differently. For some people, they actually have to put in the keypad. So as they start, when they click on this line, a keypad will come up, and they have to actually type it in. It isn't fully working with them dragging the red icon across. Then, as I mentioned before, there was a journal entry option. If I find somebody is, say, getting familiar with the app, I don't get them to focus in on this hugely until they get familiar with doing the EQ5Ds first. And then in time, I say, look, if there is an option available for you to put in journal entries, and how it can be done. Again, that focal point of the plus red, when you just press on it, and then over here you'll see add journal entry. This allows them to capture symptoms. It allows them to input, say, specifics in relation to their dietary intake. It allows them to input a photo of maybe a rash that has developed, and it also allows them to capture things like vaccines if they've had their flu vaccine and a date that it was given. So I'm going to give an overview shortly of our monthly newsletter, which I upload once a month. It's uploaded onto the Trinity Kidney Health site, and also I email it over to Julie and she puts it up on the Vasculitis Ireland website. And this gives an overview for everybody involved in the study on a monthly basis as to how many people are using the app, how many locations we're capturing, how many EQ5Ds are being filled out. So I am going to give an overview of our last month's one shortly. So to date, we have 121 app users. And as I mentioned, we're aiming to get 250. Now, of these 121, we did have a few users towards the start who downloaded the app, couldn't use it, and then re-downloaded it again. So they have 2 downloads per 1 user. So out of that 121, I looked through the figures, and actively we have 104. We do have 24 recruits that have been recruited to the project who do not have a smartphone and aren't in a position to use a smartphone. So we call those recruits as a non-app user, where they'll get a call from me every 2 months. I'll do their EQ5D or their vasculitis research survey over the phone, and I'll capture their location over the past. Now it's quite easy to do that now because not many people are moving around, but I can capture their location over the 2-month period if they've traveled or been based at home. And I can input that information into a software program that was developed for the study to capture locations. We have 5 recruits that have withdrawn for different reasons from the study, and we have 3 people, unfortunately, that have passed away. So I'm going to give an overview of the newsletter. I'm just going to stop this share. So here we have an example of the newsletter, and it'll always come out in this format, as I said, which is put on the Vasculitis Ireland page. So as I said, we have 121 RKD registered patients who are using the app, and as I mentioned, that's 104 active users. So this will show over a period of time. I came on board the project around here where we had 103. So we can see over the past few months that the recruitment to the project has increased since I've come on board with the project. And then down here we can see the amount of locations that we are capturing since last October, over a year. So there was a dip in it, and again, as I said, this is where I came on board and we started to see more locations being captured over a period of time. The app does ask for permission that you can capture, that the app can capture your location. It's important that that's activated on download. There is a way that we can check it out, and I do help people over the phone to check that the app has that permission to capture your location. And on average for September, we captured 211 locations. And then further down, we can see the EQ5Ds, and this is where I'm asking, that's the vasculitis research survey on the app, and I ask all users to complete it on a monthly basis. Unless they started to feel unwell, I do ask that they complete it a little bit more frequently. So again, this is where I came on board, and we can see an increase in the EQ5Ds being completed on a monthly basis. And from September last year, we did 134 EQ5Ds completed through the app. And hopefully that'll continue and we'll get more recruits on board as well. So that's it for me. Trish.
Okay, then thank you, Valerie. That's Valerie. Sorry, Vicky.
You're okay. You're okay.
Talking to Valerie so much this last couple of days.
Yeah, no, you're all right.
That's great, Vicky. I think that's really what this platform is about today. It's about connecting with the patients at all the different levels. So that app is that connection point. So I've asked in the chat box for people to let us know if they're on the app or want to be on the app. So there is a few questions there. Can you see them there?
I can see them here, yeah. I'm just...
Oh, yeah, looking now, yeah. So the app has stopped working since the last Apple update.
Okay. What I would recommend people to do, if they find the app isn't working, just delete it and start again, but don't re-download it. You know, delete the app from their phone, go into the iStore again, upload it again onto the phone, but go in using their original email address that they used on the initial download.
Okay. Okay.
And try starting again. Now, more than likely, a lot of people have forgotten their password. There is the option forgot password, and you can log in again once the app company get in contact with you with a new password.
So it's like any bit of technology. If it doesn't work, just shut it down and start again.
Start again, yeah.
I use the app, but I find it doesn't always work. So don't know if it's my phone or something else. That was from
in what part of it is not working? That's important to find out. Like,
well, and I suppose, Vicky, we're not going to answer them all maybe here, but if people do want to contact, how do they overcome the problem?
So my email address is rkdnurse@tcd.ie. And you can get me through that. Now, I work on the project 12 hours a week, so I generally divide it over 2 days. So if I don't get in contact straight away, I will make contact as soon as I'm back on the project again.
So you're happy for patients
to
contact you direct. So maybe we might put the email in the chat box so people can see that.
Yeah.
So the app, as we know, the technology world that we're moving into, you know, that they're going to be more and more used in all sorts of areas of our lives. So if it's something that you haven't embraced so far, let's, you know, do that. Vicky is there to help us all be online, to use the apps, use the current technology. So it's to aid your disease. It's a way of monitoring your disease. It's a way of recognizing the flares. And then in the background, it's helping the research.
I can see there's a few messages there, and probably the best thing to do would be email me your phone number, and when I'm back, I'll give you a buzz back. Because I can see there's a few people saying they're having trouble downloading it, or there's certain parts of it they can't use. So best is to email me with your contact number and I'll give you a ring back.
Yeah, and of course, if there's any problem, just go on to the Vasculitis Ireland Awareness website, and we'll also take any queries and direct them to Vicky. So is there anything else there, Vicky? You want, yeah?
Could we take Vivian Beatty's question?
Yeah, I was just going to so thanks, Vicky, for that.
Thanks very much. Thanks, everyone. I'm sorry now. I'm going to have to log out of the call. I have football to get to. But thank you for inviting me.
Okay, you're welcome. We might just hold on to Mark. There's just a question there, Mark, from Vivian. I've lost it now, Valerie, can you see it?
So Vivian was diagnosed in 2016 with kidneys failing. She was treated and has had no problems since, but her kidneys have recovered, and she's wondering, is it common to have one episode of the disease?
So I replied in the chat there, Valerie, to Vivian, and just to say that, you know, sometimes it does, probably about half the cases we never see the disease again after, particularly in ANCA, vasculitis. So it's not unusual to have a long term without any seeing the disease again. And that's obviously what we would like to have happen, particularly if we're able to stop all treatment. But I would always say that, you know, that's good, and 5, 7, 8 years down the line, still no relapses. That's fantastic. But we always say just keep an open mind, just in case something was to happen, because it can do 10, 15 years later. And we have seen it come back. So we would call this long-term remission off therapy. It's got a nice acronym, LTROT.
All right, okay. Well, that's great, Mark. Thank you.